And thank you for joining us for this edition of Healthline 3. I'm Carly Flynn Morgan. Today we're talking about heat-related health dangers in the summer with Dr. Paul Bracey from Urgent Care of Louisiana. He'll be answering your questions for the next half hour, and we want to encourage you to ask what's on your mind. If you're online, you clicked on that orange Healthline 3 box about halfway down the screen on ktbs.com. You can type in your question to the right there and submit it, or an easier way possibly is to just give us a call. The number will be there at the bottom of your screen throughout the show. It's 318-219-4569. We'll be taking your questions until 12:30. Dr. Bracey, thanks so much for being here.
Well, thanks. I'm happy to be here.
It's a good time of year to talk about this, and people don't think about it. You would think tornadoes or flooding or hurricanes would be the top weather-related killers, but really heat is one of the leading weather-related killers in the U.S. Hundreds of people die each year, according to the National Weather Service. As many as 1,250 people died in 1980 during that heat wave. So it's a serious thing, really. It is.
And you'll see, like we mentioned kind of in an intro, you'll see a lot of those fatalities in the elderly patients or in people who are in poor socioeconomic conditions where they don't have access to good ventilation or air conditioning.
Are there different heat-related dangers in the summer? Is there a range of things that could happen to you when you're overheated, or is it really just kind of one thing?
No, there's kind of a spectrum of illness, and so you can have a few different things that occur related to the heat. We were mostly kind of going to talk about muscle cramps, heat-related muscle cramps, heat exhaustion, and heat stroke. But there's also rashes that pop up, prickly heat, a lot of other things that can happen. But the most serious of any of it all is heat stroke.
What is the difference between all of those things you just mentioned, and how do you know which one you're facing if you feel symptoms?
Well, many people have experienced heat cramps, and usually that occurs in somebody who's working outside in the environment. They are taking in a large amount of water, and they kind of lower their salt level a little bit, and they're fine while they're working, but when they go to rest and relax, then the muscles start cramping up. So it's a little bit different than, say, a jogger who develops a cramp while he's jogging, while he's engaging that muscle and has a little muscle fatigue. These occur at rest when you're kind of done. You're sitting down, hopefully in the shade, drinking some water, and you develop some cramps. So those are really not considered to be a severe issue. Obviously they can cause a lot of discomfort, and what you need to do then is grab something like a low sugar sports drink, replace a little bit of electrolyte solution as well as water, and give yourself a little bit of rest.
With those cramps, I heard you mentioned that you can get low on salt in your body. I've heard recently only this thing about athletes who are exercising this summer drinking pickle juice, that helps them with their cramps or helps them because it replaces salt. Is that something that sounds like a good idea to you, or have you heard of that?
I have heard of that, and I wouldn't use pickle juice as a rehydration or kind of a measure or a salt replacement measure. There are other things in there, and you're probably doing yourself a little more harm than good, because that's such a salty solution. It can actually interfere with the absorption of the fluids and the electrolytes. So your stomach responds best to a certain threshold of electrolyte, and once you're above that, then you start pulling water out of the stomach lining, out of the organ itself, and into the middle of it, into the lumen of the stomach, and so you can actually start drawing water out of the system, and of course it dumps into the intestines, and eventually, hopefully later, it'll be reabsorbed unless you continue down that pathway of heat illness where you start vomiting and having diarrhea, in which case you're just kind of exacerbating the whole problem. So you really have to kind of be careful with how much salt you're putting in. You don't really need that much generally. The sports drinks that are out there, especially the low sugar sports drinks, are better. The old Gatorade that had a lot of sugar in it, probably not the most ideal. Now they have this G2, which is a low sugar electrolytic solution, and that is a good method of replacing kind of electrolytes. And not everybody needs electrolyte replacement. So there's a kind of a fine line, but if you're having cramps after you go sit down and rest, that means that you're a little low on salt. Don't go crazy on the salt intake, but just one bottle of a G2 or something like that would be fine. And you still need water because you're still sweating. Most of your sweat is water, and not salt. So you still need water. Water is still a great rehydration.
That was going to be my
method.
question. Water over Gatorade or G2 or something else with a little extra in it, or both, or which one?
Usually it's a combination of both. You know, if you're having heat cramps, then that means you need a little more salt. If you're not, then you've kind of acclimated, because as we acclimate, especially those of us who live in the deep south, as we acclimate, we lose less salt in our sweat, and we increase our sweat volume, but we lose less salt. It becomes mostly a water solution that we're losing, and less of a salt solution. So then water replacement becomes the biggest issue.
Okay. Is there a difference between heat exhaustion and dehydration? I hear those used a lot when you're talking about getting overheated.
Yeah, there's kind of a basic difference, I guess, between the two, and heat exhaustion will not occur without the presence of, you know, the heat stressor. Dehydration can occur at any time of the year and is largely not associated, or doesn't have to be associated with whatever the ambient temperature is outside. Part of heat exhaustion can include dehydration because as we go outside and as we kind of function in that hot environment, you know, that we're all used to experiencing every year, we undergo what's called voluntary dehydration. So we tend not to replace an equal amount of what we've lost. We only really replace about 2/3 of that, and so and we call that difference voluntary dehydration. So we all are kind of guilty of that, and it's just part of the human nature. And the key to kind of overcoming that is to either hydrate before you go outside. So pre-hydration, and you'll see that a lot in athletes, in runners. Pre-hydration, you know, drink plenty of water before you go outside. You know, if you know you're going to go to work at 8 in the morning and you're going outside, and you're or earlier than that, I guess, if you're a construction worker or anybody that works outside, and then you want to, for the couple of hours leading up to that, hydrate. But dehydration is part of the heat illness spectrum.
Okay, it seems like we have a caller at this point. Rita has a question for Dr. Bracey. Rita, thanks so much for calling. What's your concern today?
Oh, thank you. When you have had trouble in the past with heat stroke and you find yourself getting exhausted again, what are some of the things that you can do besides like Gatorade and things like that? Can you perhaps take potassium, or is there anything else that might help?
Well, thanks for calling, Rita. I appreciate it. Probably the most important thing you can do is just stay hydrated. And if you know that you're about to be in a situation where you're going to kind of put yourself into a warm environment, into that hot environment, and you're going to be exerting yourself, then the most important thing you can do is oral hydration ahead of time. You can use, it depends a lot also on your underlying health conditions. So if you have a history of, say, congestive heart failure, or you have a history of kidney problems where your kidney function is already impaired to some extent because of diabetes or high blood pressure, then you have to be careful with electrolyte replacement, because you may, accidentally overdo it. It may interfere with some of the medicines you're taking. Certain blood pressure medicines and certain fluid pills, diuretics, can affect the way that you reabsorb those electrolytes, sodium or potassium. So it does become a very individualized kind of a plan. It's relatively easy to answer that question in a very young, healthy person who has no other health conditions. But as we all age, we tend to accumulate some health problems, and so that can affect the way that we answer that question. But probably the most important thing is going to be hydration. And like I mentioned a minute ago, Gatorade is a good drink. I mean, it was invented for rehydration of athletes. The newer one, G2, is probably a better product because it has less sugar in it. And so if you're already a little dehydrated, you don't need all of that solute, all that electrolyte that's in that drink and the sugar included, because sometimes that can make you absorb the solution slower. So, and if you're getting to where you're already nauseated and you're having kind of that uneasy stomach feeling because of the heat, diarrhea is commonly associated with heat exhaustion, and it can make that worse. So you want to go with one of those newer ones like G2, which is a lower sugar containing product. And of course, if you're diabetic, you really have to watch that sugar too.
Well, the Powerades, is that in that group or?
Yeah, and I'm not real familiar with the components of Powerade. I would want to take a look at the sugar level. I think they're pretty comparable to Gatorade. I think the sugar level is pretty closely the same, but I'm not sure. But those are all those sports drinks are very similar. I think Gatorade was the first one, and I think they all kind of came out mimicking Gatorade, similar to the same amounts of electrolytes and sugar. So those are okay. I usually tell people, if you drink one of those, think about drinking a couple glasses of water too.
Oh, okay. Well, thank you so very much. You've been very helpful, and y'all have a great evening.
Well, thanks. You too, and stay safe this summer.
Thanks, Rita. Thanks so much for calling. She brings up a good point. There are some people out there who are just prone to being affected by the heat. You mentioned older people. But what about some other groups of people? I mean, kids, you see kids, they have like no filter. They just go outside when it's 100 degrees and just run around like crazy and their faces turn beet red. And then also, what about, are there any certain diseases that may make you more prone to that? I mean, anything like lupus or diabetes, is that a problem too? Well,
it can. Many of those things can. It can affect the way that we regulate heat. Can affect that we usually are associated with some medications that affect the way that we regulate heat internally, the amount of sweating that we do. Many of the medications that we take can have properties that inhibit sweating or that alter the circulation of blood in the system, or any number of kind of things like that, or the amount of urine that we produce. And you can already kind of have a propensity for dehydration depending on what medications you're taking, or how well the heart functions and squeezes. There are many people who have heart disease take medications that kind of relax the heart, so it won't beat as fast, it won't squeeze as hard, and that protects from a heart standpoint for a heart attack. But if you're stressed, it inhibits the amount of reaction that you can mount to that stress. So you do have to kind of take it easy depending on certain medical conditions. And I've mentioned congestive heart failure, we mentioned, but even medications for hypertension, diabetes, certain endocrine disorders. Yes, there's lots of people that can be more easily affected by heat illness than others. And infants are another at-risk group because they have a lot more body surface area than they have mass, and so they can't. If you're in a hot, if you're in 100+ degree weather, and you can imagine that you're just absorbing heat from externally. You're not really releasing a lot of heat through conduction and which is kind of movement of heat from one surface to another, and so babies can overheat relatively easily too, unless you kind of increase ventilation and keep them drinking their fluids, whether it's Pedialyte or formula.
How do you know if an infant is overheating? What are the signs? Because they obviously can't tell you that they don't feel good, besides crying.
Yeah, they sure can't, but lethargy and crying and fussiness kind of all play into that. So, as a mama, you know your baby better than anybody else, and you can use that motherly instinct just to kind of tell if there's something wrong. You would be wise as a healthcare provider to pay attention to that. But initially irritability, crying, kind of inconsolability that then progresses to lethargy. That's a pretty classic stress response in infants. And one that you would expect to see in that kind of a situation. If you feel them, do they feel warmer, their skin to the touch, or do they turn at all, red from being hot? Well, just like other people, initially, yes. Initially, you are flush. Initially, you are you feel hot. You are red, and that's a normal response. That is how we normally dissipate heat. So what happens is there are all kinds of mediators that are involved in this, but you dilate the blood vessels at the skin level to shunt blood out to the skin to try to get the heat off, essentially. And so when that happens, that's when you flush. And that's why kids, even healthy kids, you know, they run around outside, their faces beat red. Well, they're trying to lose the heat that they're building up when they're running and playing and having a good time. And so that's a normal response. That's what you expect to see. And then as circulatory failure occurs or cardiovascular collapse starts to occur, so you start looking at shock and you start seeing more of a heat stroke rather than just being hot or even heat exhaustion. Then you can start to see that many of those mechanisms fail, and so then you may not be as flush. You may not be. You definitely will start to have some lethargy, start to have irritability, and in adults confusion, and so that exam will change. And in you know, just a hot person, we've all sweat. You know, in somebody with heat exhaustion, you still sweat a lot. If it's a case of classic heat stroke, which is more like an elderly person locked in a room, not locked in a room, but isolated in a room voluntarily, where they kind of go into their apartment or whatever, and there's not a lot of ventilation, and over time, you know, they kind of go down this spectrum of illness and end up at heat stroke. Then they will stop sweating. And so you stop producing sweat, and that's as all these kind of regulatory things start failing. In a young, healthy person who's out running and playing and having a good time, half of those people won't stop sweating. They'll continue to sweat. So you can't use that as a marker of heat exhaustion versus heat stroke. But you will notice a change in the skin usually.
You mentioned what people should drink if they're starting to feel badly. What about, I know if I get overheated, I kind of want to go in the freezer and put cold peas on my forehead or something, you know, or you know, maybe take an ice pack, or eat some cold fruits, maybe like a watermelon or some grapes that have been in the fridge. How does any of that help? Well,
I mean, I think probably the most important thing that you mentioned in all that was that you got out of the heat.
Okay.
And so yeah, and you know, the first thing to do is you know, get yourself out of that situation, get yourself out of the heat, move to the shade if there's no air conditioning indoors or anything like that, or if you're working with somebody or you're out with somebody, you're at the beach or you're whatever it is, you know, when you start feeling that dizziness, you start feeling that thirst, you start feeling that kind of that headache, that upset stomach, you know, not feeling right. Get out of the heat. Get out of the heat. You know, don't push it. Just go. You know, even if it's go sitting in the shade, let the breeze hit you. You know, if you've got one of those little bottle sprayers with the fan, those are great. And then drink some fluids. And if you have, you know, cold fruits and things like that, that's fine, because they're providing you electrolytes. They're providing you some water. I wouldn't use those strictly alone to do it, but that, you know, there's nothing wrong with that.
Once you do those things, how long does it really take to recover where it's safe to possibly go back into the heat, or, you know, join your friends again in a game? Is it just until you feel better, or should you wait until you see certain signs, or what?
Well, you will probably start to feel better before you're maximally hydrated again. And you want to, you know, hydrate. So if you can hydrate and you're in the shade and you're cooling off and you get to where you're feeling good again, you know, it's okay if you don't have any other health problems. If you do have other health problems and you start feeling that way, and it's probably, and you're on, you know, a list of medications, it's probably best just to kind of say enough is enough. Let's, you know, go in and spend some time cooling off, have some cool indoor time, you know, while you hydrate and kind of take care of the hydration status.
How quickly does this happen, especially in the case of the elderly people, like you said, at their house? You know, a heat wave can last for a few days. It could be 110 degrees. Can it take that long to get overheated? A couple hours? I mean, what is kind of the time frame there? It
can take as little as just a few hours. So in certain situations and given certain health problems. So when we consider our geriatric patients, our elderly patients, it doesn't take 3 days, you know. If they are, and part of that also has to do not only with the medications they take, but a lot of our seniors are on fixed incomes, so they, tend to keep their homes warmer than people who are not. You're forced into a situation where you have to make economic decisions, and so the thermostat gets turned up a little bit. And elderly patients also don't tend to realize the effect of the heat. So they tend not to feel that heat effect as much as a young person. We've all probably had elderly great-grandparents or grandparents, and you've gone over their house and it's just like sweltering hot in there, and you're like, oh my gosh.
That's true.
How are you?
My grandparents lived in Florida. I remember visiting them, and my granddad would wear a sweater all the time and pants in Florida.
Right, and that is extremely common. It's because they don't feel that effect of the heat the way that younger adults do. And so there's several issues that kind of add together that make them an at-risk group.
We talked a little bit about what to do to make yourself feel better and how long it takes to feel better, but how do you know when you or someone else actually needs to go to the hospital?
Well, one of the first signs is, as far as needing to go seek medical care, is confusion. So you'll see that in somebody who's really getting overheated, and they may be talking about how thirsty they are. They may talk about how tired they feel or just not feeling well, and getting them out in the shade and letting them cool off. That a lot of times will kind of help fix that problem. And even people who have heat exhaustion may need IV fluid hydration if there's enough of a dehydration that occurs, even in the absence of true heat stroke. So when you're starting to feel really dizzy, and then if you start vomiting, you can't hydrate. And if you're sick at your stomach and every time you try to take a little sip of something, if it's not working, then you're kind of declaring yourself somebody that's going to need IV fluid, and that can happen in a clinic situation or in the ER situation. But true heat stroke comes along with some neurologic symptoms, and that is a true emergency. And the thing to really do in that situation is to get to the hospital to get that body temperature lowered. It can occur and frequently does occur with dehydration, and so fluid replacement becomes one method of treatment, but the most important treatment method is to lower that core body temperature.
What is actually physically happening in your body when you're dehydrated and or overheated? As it comes to like your organs and just like what is physically happening to you?
Well, one of your compensatory mechanisms is that when you start to lose fluid, which is blood volume, your body is going to undergo a number of mechanisms to accommodate for that. And one of the things that's going to happen is you're going to shut down some of the urine production. You're going to hang on to as much of the water as you can. And then you're adding the heat component on top of it. So you're going to flush the skin. Blood is going to flow out to the skin to cool the body temperatures, because what's happening is the core body temperature is elevating beyond the point that your brain, or more specifically the hypothalamus, wants it to be. And so the hypothalamus kind of drives many of these things, but a lot of them are also independently occurring. And so you flush the skin to try to cause heat loss that way. One of the things that happens when you flush the skin is part of what happens is you decrease blood flow to the internal organs. So the GI tract, notoriously, and that can cause nausea, that can cause vomiting, and that can cause some diarrhea. As a matter of fact, you'll see that sometimes in long distance runners who are not even all that overheated. They'll finish a race and they'll be nauseated, and there may be some vomiting that occurs, and there may be some diarrhea that occurs, and it's because of that shunting of the blood flow away from the GI tract. So also it can affect the liver, it can affect the heart, depending on how far down that mechanism you are. So one of the things that happens is the heart speeds up, and your breathing increases. So you become very what we consider kind of dynamic from a circulatory standpoint or cardiovascular standpoint. And if you have issues with those compensation mechanisms, then it can really impair your ability to dissipate that heat and to cool yourself. And that's where you kind of cross that line over into heat stroke, because you can no longer regulate your own body temperature. And all of these should also be considered completely and totally separate from fever. You know, I don't want anybody to confuse fever with this type of a heat illness, because a fever is a totally different phenomenon, and nobody can die of a fever in and of itself. So fever is a whole nother animal, so to speak.
A lot of young people like to take a cooler to the beach or by the pool and drink alcohol when it's hot and during the summer, and that can really exacerbate this, I would imagine, right?
It really can. Alcohol in extreme heat is just not a good idea, and you know, it's a common thing, you know, to have an alcoholic beverage either at the pool or at the beach or on, you know, at the lake. Hopefully, you're not in a boat and operating anything while you're doing that, but it's a common kind of an occurrence, but it is probably one of the worst things you can do. Alcohol is a diuretic, so it makes you produce urine. So you're going to lose water, and you're not taking in as much as you're losing. So anybody that's familiar with drinking beer knows that, you know, that you produce more urine. And any alcoholic beverage does that. It's the alcohol, not necessarily the volume that you're drinking, although the volume does add to it. But it also can interfere with your ability to compensate for heat loss or heat gain. And so alcohol is a common culprit when it comes to heat-related illness, whether it's too hot outside or too cold outside. Either way, it'll interfere with that process. And then it also impairs your judgment. So then you don't drink as much liquid that you need to drink. You go back and grab another beer instead of grabbing some water, or, you know, grabbing that Gatorade. So there's a lot, you know, related to alcohol that can affect these processes, and it's just not a good idea. I understand it happens, and lots of people do it, but I would just recommend not doing it.
Right.
Yeah.
Is there an amount of water that you think is a good amount to drink before or during when you're exercising or you're going to be outside and it's going to be really hot? I know you're supposed to drink like 8 glasses of water a day on the regular, so should you drink more when it's hot outside? Well,
yeah, and we are talking about healthy people, you know, so certain people shouldn't drink that much water, but that's very few. Healthy people generally should maximally hydrate. You know, one of the easiest ways to tell if you're hydrated enough is to check your urine. If your urine is dark, if it's yellow, you know, then you're just not drinking enough water and you need to get more water in. But pre-hydration with several glasses of water over a period of an hour or so before you go outside is a good thing to do. It makes sure that you are maximally hydrated before you put yourself into that environment where you know you're going to have water loss.
We talked a little bit earlier about heat-related cramps. Mm-hmm. If you're having cramps, are you able to take Tylenol for that? Is that something that you should mix, or, you know, if you're not feeling well and you're being affected by the heat, can Tylenol or ibuprofen or things like that actually have a bad effect on you?
Actually, they can. If you are in heat exhaustion, and especially if you're at the phase of heat stroke where somebody else is going to be administering the Tylenol or the ibuprofen, those can cause problems. Heat exhaustion occurs, and when it does, causes liver damage. So that's usually temporary if you survive the episode. So Tylenol could hurt. You're already putting a strain on the kidneys with dehydration, with certain chemical mediators that are let loose in the bloodstream from the muscles. Something called rhabdomyolysis can occur. And when you use NSAIDs, ibuprofens, or salicylates, you can further cause more kidney damage, can interfere with cardiac function. So you really, you don't really want to do that. The biggest way to treat those cramps is with a salt solution, you know, Gatorade or something like that, and rest, and then you know, let it pass, because usually they're short-lived.
How many people do you see at the urgent care clinic from this during the summer? Is it daily, or? Yeah,
we'll see several patients over the course of a week, usually with some, obviously not heat stroke, but maybe with heat cramps or with some degree of heat exhaustion.
What do you want to really hammer home in our last 30 seconds here? What do you want people to remember about being safe in the heat this summer?
Hydrate, hydrate, hydrate. If you feel dizzy, get out of the heat. Take yourself out of the environment. You know, if you're starting to feel bad, don't stay there. Go cool off and drink fluids.
Listen to your own body.
Exactly.
Good in any situation.
Exactly.
Dr. Bracey from Urgent Care of Louisiana, thanks so much for being here today and giving us this important information.
You bet. Happy to do so.
Have a great day, everybody.